and welcome to our Fianna Fáil Women's Network live Zoom event in celebration of the International Women's Day. My name is Councillor Uruemu Adejimni. I am the Secretary of Fianna Fáil Women's Network. I am joined by Senator Fiona Chair of the Women's Caucus, and Vera Kelly, a healthcare worker. And we're going to be talking about the effects of COVID-19 pandemic on women in Ireland. I think we'll all agree that we've all been hugely affected by the pandemic. And I suppose COVID-19 has shown an exacerbation of the existing inequalities in terms of women's role in society. And this is supported by the CSO data published in February 2021 on in terms of the female respondents to who reported low overall life satisfaction compared to male counterparts, where we saw that 16.9% of female respondents reported feeling lonely all or most of the time, compared to 9.2% of men. And 62.4% of female respondents reported that their mental health and well-being has been negatively affected by the COVID pandemic, compared with just 51.7% of male respondents. So these are, stark figures showing how COVID-19 has disproportionately affected women in society more than men. So I suppose we are going to do a deep dive into three key areas, which are employment, role in society and in the home as primary caregivers, and domestic violence. So I'm going to hand over to Fiona O'Loughlin to kick things off with employment.
Thanks very much, Uruemu, and it's lovely to have had the opportunity to have a chat with yourself and Vera, just in relation to the impacts of COVID on women in 2021. And I think it's very appropriate that we look at this really around International Women's Day this year, because as we know, the theme of International Women's Day is around challenge. And I just think women have had so many challenges, more than ever, during the last 12 months. And even when we look at the whole area of employment, and when we see the areas that women have predominantly been employed in during the last 12 months, and indeed those that have positions but haven't been working over the last 12 months, the figures are equally stark. I mean, like we all acknowledge, and I think it's about 78% of those that are healthcare frontline workers are women. So we have seen women putting themselves at risk completely over the last 12 months. And it's been very difficult for them while they've been trying to run homes. And of course, there's been an impact on them trying to homeschool children during that period of time. And I'm really looking forward to hearing Vera's views in relation to that, living in a house with 3 healthcare professionals and the impact that it has had on them. But also when we look at the world of employment in relation to retail, so many of those that are in our essential services, when we go to the supermarkets to get our food, a lot of those that we meet are women. And again, they're trying to balance their own home care situations, homeschooling situations, with working to support us and to ensure that we all have our food supplies. But take it then again on another level in terms of the businesses that have closed and have closed in a huge way over the last 12 months, both in terms of the whole hospitality industry and the boutiques, clothes shops, shoe shops. So a lot of women are on the PUP payment. And in fact, when you look at the employment figures, I think for male unemployment figures are around 24%, but it's about 28% for women. And the gender pay gap prior to COVID was 14.4%, which is very significant. But I would say that post-COVID, that it's going to be a far greater gap. So while we really were looking at ways of how we could address the gender gap going forward, it's going to be a worse situation than ever before. So really, we've been taking retrograde steps. So there's a lot of challenges and issues for us in terms of supporting women who have been working during the whole COVID crisis. And Vera, that brings me to you. I know that you have a situation where you're a healthcare professional yourself, and your husband and your daughter. So I can only begin to imagine the stress and the pressure in your home with three of you working on the front line. So would you like to share a little of that with us?
Well, I think initially when COVID emerged this time last year, actually, I remember it was Mother's Day last year. I think it was that weekend was the first weekend of lockdown last year. And we would have been under huge pressure in the house, where we had my daughter going into a general hospital, and both myself and my husband working in mental health. And I suppose it was for her, she was so young. They had changes in their work practices, like wearing PPE, like we did as well. But I think that we were coming from more of a mature background in healthcare, and would have been used to infection control and managing infection control. And but for her, I was very afraid for her. Every day she went to work, I was afraid for her. And it's very hard to express that to her when she's going out, because you want to be positive and, you know, sending her forward. But for us in the house then, there was challenges all the time, because she could be a close contact. She'd be off duty. She'd get a phone call to say she was close contact. She'd have to isolate herself from us. We didn't know whether we had contacted something then at that stage. She was going for testing. Then initially we were all well and kept well, and she then got COVID, and we were isolated from her, and we had to go through the procedure within the household. We had to be tested because we were a close contact. And it just seemed to be going from 1 week, every second or third week, we were a close contact or she was a close contact. And it was a roller coaster at the beginning. I think now, since the vaccines have been given, my husband has had his first vaccine, my daughter has been fully vaccinated, that it has kind of eased the pressure in the household, but it's still out there for me that I actually haven't been vaccinated. I'm an agency nurse, so I haven't been vaccinated yet, and I'm waiting to be vaccinated. But it was an ongoing pressure on us, and as well as too, it was mental health issues that were emerging, like within our profession and within the local community. People know that I'm a mental health professional, and they would be coming to me, not specifically coming to me, but they felt that they could talk to me, and issues would have come up about mental health within the home, within the carers within the home. And I know that you're going to address that later on, that you're going to address it and speak about it. But the mental health issues that were emerging about people trying to juggle all of the care that was needed in the home with schooling, with, you know, caring for an elderly person, etc. Like, so all of those things have emerged over the year. But as healthcare professionals, it's a challenge. It's an ongoing challenge, and it's really like it's a blur that we have gone through the last year working within the system that we've worked. And I mean, we have been lucky that we haven't been infected, but that is down to the care and the work that has been done on the ground in the hospitals, and with the healthcare providers, and the work that we would have done on a one-to-one basis with our clients. But for our clients, they have been disadvantaged too, because I would be very used to kind of a tactile relationship with our patients, that you'd be very close to them and very involved in their care. And like, we've had to step that back. Like, you've had incidents where patients are interviewed on, you know, kind of on video conferencing and things like that. And we have that experience with our own GP now, that's the way you actually initial consultation would be over the phone. So that has changed too. And then the workplace environment has changed in that you're not going out with friends at lunchtime or going to the canteen with people at lunchtime. You're distanced from them. You want to keep yourself safe. And the other thing then is the wearing of PPE, that we're not used to that. We were not used to that. And that was a challenge at the beginning. But those things have just eased over the time. And I think we've kind of got used to it. We haven't got complacent, but we've got used to it. And I think that a lot of nurses, they have stepped, and doctors, the healthcare workers, they have actually stepped up to the task of caring. And the World Health Organization would say that 2/3 of the workforce are women. And I suppose the sad thing for me is that an awful lot of the women, like you're talking about in retail, that would be like they wouldn't be paid as much as their male counterparts, and their contribution wouldn't be seen as viable as that of a male. And an awful lot of women, and particularly in the caring profession, would give a lot of informal care, like to an elderly relative or to a child that's disabled, or it's informal in that it's not accounted for. And in some ways, we don't realise the amount of informal care that's given out there, and the majority of it is given by women.
Thanks, Vera. I think even myself as a mother, having to work through homeschooling my children, I certainly feel that I'm taking on a lion's share of the work in the home due to COVID. And I suppose every woman feels that way at this stage, which is, making me think, and which should encourage all of us to think of how we're raising our children in the home, how we distribute chores, so that, we need to actively start working towards, changing things and balancing life in the home more, particularly for families like mine, where we have both male and female children, so that certain chores don't appear to be specifically geared towards one gender. So that's something I'm taking on from this pandemic, and indeed is what I have tried to do, raising my children. And it just even makes me think about even going beyond the home, in terms of even in the school, how subjects are chosen, where boys tend to lean towards certain subjects and girls tend to lean towards certain subjects as well, which then I suppose roll on to the work environment, where you have higher paid jobs being taken on by more male than female cohorts in the workplace. And my mind is drawn to Article 41.2, which pretty much says that a woman should not feel the need to neglect her duties at home for economic reasons. Now this is me ad-libbing the article per se. And that inadvertently promotes inequality in terms of pay, because it is then considered or in hushed tones that a woman would only take on a job as an added income to support the man, which then puts the onus on employers to give their male employees enough pay so that their wives do not have to leave the home to seek employment. So, there has to be change in that article, and have been called for that article to be abolished and replaced with a more balanced, I suppose, a more balanced attitude towards household chores. Like Vera rightly mentioned, that the man who is now a parent in the home, and the monotony of home care, it shouldn't be just the charge of the woman completely to look after things in the home. And I know in my household, if there is an issue, the decision automatically is deferred to myself. Like, Mom, what do we do? This has happened. And I'm thinking, why is it just me, in my head, obviously? Why is it just me having to make this decision? It should be a joint decision, of both parents. So I think it's really highlighting the issues, having to make sure the kids get up on time and log on to their Zoom classroom and get their homework done and check the homework and all of those things. While I enjoy doing it, and I feel that it is an opportunity to to bond further with the children. And it is something that needs to be done, a balance between both parents as well. So I think my husband should enjoy that bonding as well, while I suppose I have a relief in terms of those responsibilities. So these are things that we need to start thinking on, and as we navigate through COVID, and definitely the end is in sight, because we are getting the vaccinations rolled out, and please God, by summer will be at the end of this. We need to start thinking of how to future-proof our society, so that there is equity and there is equality. And I was chatting to my sister yesterday about her daughter who changed schools, and she's in middle school in the US. And she talked about a Jedi training that they go through in schools in the US, which is justice, equity, diversity, and inclusion. And it was very interesting to hear that. And it's something I think that would be worth considering, so that in every work of life, because you have schools, I think the local secondary school in my town, we have an all-male school and an all-female school. And the female school, maybe they've changed now, but from when I was informed, they don't have engineering programs in senior year, like technology or technical graphics. Whereas the male school, then they don't have home economics as a subject. So again, this is kind of, feeding into this to inequality, where it's expected that girls would prefer to do home economics and boys would prefer to do woodwork and technology. So again, schools need to look at their curriculum and make it as gender neutral as possible. Like it's something that will need a lot of work and will need collective effort. And as we are navigating through COVID and seeing these inequalities at play, hopefully, everybody will work together and push things to a more even ground, which hopefully would reflect in a representation, in gender representation in politics as well. We're hearing the data and the states and the stats of how, there has been a significant increase. And then as well, the services around domestic violence victims was also curtailed. So it's really made it a very, very very stressful time for a lot of families. And we hear the Director of Public Prosecution saying that there's been an 87% increase in cases related to domestic violence and breaches of court orders. So I'd like to hear your thoughts on this, Fiona, and this issue of domestic violence and what needs to be done to support victims of domestic violence.
Thanks, Remu. Yeah, it's been really stark reading, I think, looking at all the research that has been done and the report from Safe Ireland, who work with 30 different agencies around the country in terms of helping tackle domestic abuse. But for all that it is stark reading, can you even begin to imagine how difficult it is for women in that situation? And of course, for men, we have to acknowledge that there are male victims of domestic abuse as well, but absolutely predominantly, it's mainly women. And they're in situations where they're finding it very hard. They're completely hemmed in. They're afraid for their children. Thankfully, some children are back to school now, and I know we're all looking forward to all of our school-going children being back in the classroom. But for those children that were caught in that situation over the last number of months, it's been very difficult for a mum trying to protect and mind their children, as well as protecting themselves. And, all mums put their children first and often put themselves at risk in terms of caring for their children. So when we look back over the last 12 months in terms of the number of lockdowns that we've had, we know that all of the risks for domestic violence have been absolutely amplified, and the risks are really such as household stress. So I think the stress in every household has really been amplified for lots of different reasons. A lot of people maybe within a small cramped space, particularly those maybe who don't have any outdoor space whatsoever, and you have parents trying to work remotely, or indeed if they're frontline workers, and then siblings are trying to look after younger siblings while they're also trying to do some of their own schoolwork, etc. And then of course we have the impact, as Vera said, on mental health. More people are depressed, and sometimes, you know, through that stress and depression comes anger, and people are hitting out at their nearest and their dearest, and that brings about a lot of conflict in relationships. More people have been suffering poverty, while it's great that the PUP payment was in place. And then for most people in the public service, their pay wasn't impacted. But for those that were self-employed and those that are on the PUP but have maybe very significant mortgages, that certainly caused concern. There absolutely, most certainly was an overabuse of alcohol when we saw the sales of alcohol going through the roof. And then isolation, if somebody, you know, maybe has addiction problems, they're suffering from stress, they feel isolated, but they're in this very sort of, you know, tight-knit home domestic space. You know, unfortunately, domestic abuse absolutely has been on the rise. And one of the most interesting insights, but one of the scariest insights that Safe Ireland had in relation to their report, you know, tracking the shadow pandemic, was that 3,500 women who made contact with the 30 organisations were actually contacting for the very first time. So while it may have been expected that where there were cases of domestic abuse before, that you know would be triggered off again, we actually had 3,500 new situations, and that accounted for 25% of the calls for help. Now that, and I think, you know, we probably should say that the Still Here campaign is ongoing. And that's really important, that women know that those supports are there. And also one of the areas that I spoke about in the last Dáil was in relation to women getting unpaid leave, in terms of if they're going through a domestic violence situation, that they should be able to take extra days of leave in order to, maybe for court situations, or to support children through what they're going through. So everything that we need to put in place has to be about supporting the victim and empowering them not to be a victim any longer, but to be able to have a better and more positive life for themselves and their children.
Yeah, absolutely. And I think if there's some, I suppose, some small comfort to be taken out of this pandemic, is that it's highlighting so many societal issues and really drawing attention to these challenges that women face on a daily basis, and kind of making it a sort of imperative that lasting solutions be put in place, so that, you know, post-COVID, everybody has, I suppose, a better quality of life and better opportunities to live their life to their full potential. And I suppose on that note, if we want to just possibly maybe share one positive of COVID in terms of our experiences and how we've tried to, obviously, I'm the kind of person that thinks of advantages to help me get through difficult situations, and so I'd like to just ask yourself, Vera, first of all, what positive you can share that you have gotten out of this COVID pandemic.
Oh, well, I would actually say there's quite a lot of positives, which are some ways an advantage, or, you know, you probably wouldn't want to say it, but like, for me, I would have seen like that I suppose I would have questioned before the pandemic, how was society going to keep up the pace of what they were doing? Like women and men were getting their children ready. They were dropping them to the creches. They were dropping them to childcare. They were going to work early in the morning. They were leaving home early in the morning. They were home at 6 o'clock in the evening, 7 o'clock in the evening, gathering their thoughts together, getting a meal ready, getting their children, maybe some homework, getting their children ready for bed, and they were gone. And like just continuous work, and it was a continuous cycle. On a Saturday morning, then they hadn't really time to wind down. They needed to maybe bring children to practices or whatever. And you just wonder, how will this keep going? Because people were not getting quality time with their children. They weren't getting quality time as a family. And I see now, and I'm lucky that I live on the Greenway, that families are out, they're out cycling, that there is much more quality time. There is much more time spent with children. Parents have had to learn how to amuse their children, because they were gone to creche during the week. They were going to bed when they came home. On a Saturday, they had outdoor activities. So they didn't actually have to amuse their children. And for me, that is a positive, in that family life now has improved, even though it is within a confined space for an awful lot. And you would have, like, I think 25% of domestic abuse cases that were reported in the first quarter of the COVID outbreak. But for me, it is family time that has been got, that you can never get again. Like for young parents, for young mothers, young fathers, they have got quality time with their children. So that would be one positive for me.
That's good, Vera. And in terms of my family as well, I think we have benefited from the family time, because before COVID, it's you'd hardly bring us all together, because everybody has the different distractions and different activities after school. But with the pandemic, particularly when it started initially, we had to think of ways to entertain ourselves, amuse ourselves, as you say. So it's been, that definitely is a positive, I find, as well. So Fiona, do you want to share?
Yeah, of course. I think that we've all had a chance to reassess priorities and to think about the little things that mean a lot to us. And I know that when there was the opportunity in between lockdowns, for example, to go to a family home, that I spent more time with my mother and my brother, who lives with my mother. And we played games. We played Scrabble, we played dominoes, we played cards. And in fact, over Christmas, now I'm one of 11 children, so normally there's 30 plus on Christmas Day, and it's just bedlam. This year there was only 5 of us, and we had just a real quality time. And myself and another sister and brother, we did private testing before we went home for that, and we stayed in that bubble for a week. And we really had such a lovely, quiet space of family time that we never would have had otherwise, because like that, it was always going all the time. So I think having had that opportunity to slow down, and while life is very busy in terms of, just the necessity of politics to work, and the necessity of a lot of, Zoom meetings and Zoom calls, the fact that for me personally, I'm not racing around the constituency of Cllr, not racing between Dublin and home all the time to try to get to a public meeting, means that even though I'm busy, that I've more time to read. I always loved reading. I read since I was a child, and for the last few years, I just did not get a chance to read. So having that opportunity to go to bed a little bit early and just read a really, really good book is like manna from heaven. And also, I think in terms of cooking, I've always enjoyed cooking, but over the last few years, it nearly was more takeaways or grabbing food that you would just reheat. And I found I've gone back to preparing food, which obviously is healthier as well. So those things, I miss obviously my friends, and I miss not seeing them. But when there was a time that we could meet you know, and go for a small walk or something. That was really, really nice as well. So yeah, there certainly have been moments. And how about you, Remo? What have you found?
Yeah, I think spending more time outdoors has been another positive for me, just in relation to having to taking advantage of a slower pace and more time for family. I think I'm actually participating in the 100 days of walking, which means I get a chance to go out and clear my head, take the dog on a walk, and must have heard the barking during the conversation as well. So that's the sights and sounds of Zoom life. So it's that for me has been a positive way just to breathe and de-stress and kind of take out all the negative feelings from COVID, which can tend to set in when you're kind of confined, and I suppose our natural human desires of you know, meeting up with friends or going to lunch, you know, those things are not there because we really are social animals and we're not used to being confined in this way. So that has been a positive for me, and obviously it's nearly going back to nature, so to speak, and it's certainly helping in reducing our carbon footprint, which is good for the environment as well. So you know, I just throw it out there to everyone watching and listening as well, to think about what their positives they've taken from COVID as well, and I hope that will give some small comfort as we, you know, work towards exiting COVID. And I'd like to wish everyone a happy International Women's Day. Thank you very much.
And to you, Remo, let's all choose to challenge in 2021 and continue the really, really good work that the Women's Network is doing. And to you, Vera, just you're representing all of those female frontline workers here today, and just our heartfelt gratitude. What all of you has done has saved so many lives and has helped support mothers and women right around the country.
Thanks very much. And I was absolutely delighted to be able to take part in this today. And yes, I think, yeah, we have done a huge amount of work. 70% of the workforce in the healthcare sector are women. But you know what? We take it in our stride. And I suppose that's the good thing about women. They're very adaptable. You know, they're good at multitasking. And I'm just delighted that we could give that contribution, and it's ongoing. And we'll do our best. With the males, we will work alongside, and we are working very well together, and we have a lot to give, and we'll continue to give it.
Thank you. Absolutely. Women are resilient, and
yes,
we need the support of the support of our allies, the male, to get things going. So thanks very much, everyone, and have a good evening.